And now, let's look at sacroiliac joint issues and how to treat them with laser. I want to thank Companion for sponsoring OPV and supplying the laser for me to teach you with today. As always, we start with our goals. Our goals for treating SI pain and restricted motion are to decrease the pain on SI motion so the patient can move free and not acquire compensatory issues, and treat the common areas of compensatory issues, and then be able to build strength and have a long-term pain-free life. Let's look at some fun anatomy. I put in an x-ray and some pictures, as well as some drawings, so you have a really good idea of where you're lasering. Up here, my x-ray, I labeled S for sacrum, I for ilium, A for acetabulum, and IS for ischium. I want you to look at the SI joint, coming right in here and right in there. With this joint, what I want you to see, if we want to find it, we can actually feel. So we can go to the most dorsal aspect and then slide back just before it drops off. That's going to be the most cranial aspect of the SI joint. Then when we come down, our finger is going to slide off the ilium. We can't feel it anymore because of the muscle. And that's going to be the caudal aspect of the SI joint right there. Let's look at it on the picture. I like this picture because it shows the bump. You find the most dorsal aspect of the wing of the ilium and slide, you're going to feel that bump. That's my cranial aspect of my SI joint. And then I slide down until I can't feel it anymore because there's muscle here. And if I stick my finger in, I can actually feel the transverse process of S3 hitting my fingertip. That's the caudal aspect of the SI joint. One more picture from the lateral side. Again, my most dorsal aspect, there's my bump. I slide down, and that's the end or the caudal aspect of my SI joint. Let's look at it, some more pictures. I know it's a lot of pictures, but that's okay. It's all good information. Up here, I have the spine, sacrum. The reason I have this is so you can see the transverse processes. So if you put the ventral aspect of your laser against the transverse processes, which we're going to show you how to find, you're shooting right into the intervertebral foramen. When I come down here, I want you to see that I can shoot straight in, so in the lateral aspect, shooting into the intervertebral foramen, and come up over my dorsal spinous processes and down, shoot into my intervertebral foramen, and come back and forth. I can also, when I'm hitting 10 to 15 degrees from lateral to medial, I'm getting into my facet joint. Let's look at the facet joint. There you go. There's my 10 to 15 degrees. That's where I'm shooting, I'm aiming for. I put this picture in because I want you to see a sacrum, the SI joint, is not smooth like a stifle or a hip. It's actually all bumpy inside. So it's going to be really important that we shoot directly into it so that energy can bounce around in the joint and get everything treated. Lastly, I put this image in so that you can see when you're treating, you do want to definitely go from medial to lateral about 20 degrees so that you can aim into that joint. Told you, lots of pictures, lots of good information. This way you'll have nice, efficient, effective treatment for your SI joint and supporting tissue. All right, let's look at the bones. Here's Spike. We're going to go to the back end of Spike, and I want you to look at the wing of the ilium. So if I come to the most dorsal aspect, you can see I follow it back. I have that bump right there. If I come just inside of that, that's right where my SI joint, or sacroiliac joint, starts. Then, if we put them back together, and I slide my finger down, it disappears. I can't feel the bone anymore. It's all muscle. But if I stuck my finger straight in, I'd feel the transverse process of S3. That's where my caudal aspect of my SI joint is. So I can identify him. I also want you to see, if I open that up, he truly is a 20-degree angle from medial to lateral. So I want to aim this direction. Going from the SI joint, I want to look at the facet joints. If we look in here, you can see the angle. It's a 10 to 15 degree angle from lateral to medial. So here's my dorsal spinous process. I'm going to be aiming in this direction. Lastly, I want you to see the transverse processes. We're going to follow muscle around till we get to where the iliocostalis ends. You'll feel muscle, 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 and then it stops. There's our transverse processes. If we have the ventral aspect of our laser shooting right in there, we're going right into the intervertebral foramen. So hopefully our energy is going into the spinal cord, the nerve roots, the nerves coming out, all of that. All right, let's look at our dog anatomy. The first thing we want to do is feel the wing of the ilium. Once we find that, we go to the most dorsal aspect and slide back slightly. You'll feel a little bump. That's the most cranial aspect of the SI joint. Just medial to it, of course. If we then follow it down until our finger disappears, we can't follow that ilium anymore. If we were to go straight in, we can actually palpate the transverse process of S3. That's the most caudal aspect of our SI joint. So we've just identified if we have our ilium just inside, and we know it goes at a 20-degree angle from medial to lateral. That's going to be important, okay? The other thing we can do then is come back up to our top part of our wing of the ilium and slide to midline and then back, and we fall into a hole. That hole is our lumbosacral joint. From there, we can come up and we feel a dorsal spinous process, right? That's L7, L6, L5. If we go just lateral to L5 and 6 and 7, we're going to be over our facet joints, and our facet joints come from lateral to medial, so the opposite of our SI joint, 10 to 15 degrees. We can also follow that around where it's muscle, 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 and then it gets soft. If we palpate that line, that's just at the ventral aspect of our iliocostalis, you can actually palpate, in most dogs, the transverse processes of the lumbar spine. And we know once we find those, just dorsal to that is right into our intervertebral foramen. Today we're going to be using the companion laser. The first thing I'm going to do is hit start. I've already done that. It takes a minute to initialize, so I didn't want to waste time. Now we're going to add our code. 1, 2, 3, 4. Pretty easy. And then enter. Now I have my choice. I can either hit operation, and then I can choose all my parameters, or I can go into protocol and make it easy. For today, with Ollie, we're going to use a protocol. We're going to start with canine. He's 85 pounds. He's average body type. Short coat, light skin color. Next. I have all my parameters right here. I'm going to hit pain and trauma. I'm going to go for lumbar, because that's close to the SI. About the same amount of energy we're going to need. I hit next, and it sets everything up for me. Now I can change any of my parameters, whether I can go from continuous to pulsed, or I can change my power. I can even hit max treat, which means I'm going to get everything with no pulse whatsoever, and that will give me the shortest time. Not always the best, but we have that option. My other thing I want to do is look at my hand piece. I can depress this button right here, twist, and my head will come off. I have other heads I can choose from. You can see them up there. But for today, this is what we're going to use. If I look here, it tells me that's what's on. It's green. I could change to this one, but it would not be a good idea to change to the other two. When I'm ready, I'll hold on to my handpiece and hit stamp. And as you can see, my little green light is blinking, telling me it's getting ready. That's my safety check. And all I have to do is depress this button, and we're good to go. Now, we have to make sure everyone has their glasses on first, patients and people in the room. And when I'm done, I can depress the button again, or I can do that to pause it. And when I'm totally done, I can stop the machine by just pressing my on button again, and it's all off. If I was treating Ollie's SI joint with a Respond laser, I'd start with my 808 nanometer 1 watt probe. Light-coated dog, I would be treating at 1 watt, and a dark coat or skin dog, I'd be treating at 0.5 watt. I would use that probe, and I'd treat right over my SI joint capsule, so over my joint line. I would treat over my facet joints, and I would also treat over my intervertebral foramen. Then I would pop that off and put on my 904 5 watt probe. With that, I can treat all of the supporting structure really easily. I would start when he's painful at 8 joules per centimeter squared, And then when we can strengthen and work with healing, I would drop it down to 4 joules per centimeter squared.
If I had a respond laser, I would use the 808 nanometer probes. I would use the 1 watt probe over the facet joint line and the sacroiliac joint line for precision, and the 5 watt probe for ease of treating the rest of the tissue. I would treat with either 1 watt or 5 watts, depending on how much machine you have, of power, and start with 8 joules per centimeter squared while the dog is painful. Once the pain is in check, we can decrease the dose to 4 joules per centimeter squared as we heal the tissue and then build strength. And if I had a SpectraVet laser, I would use the 810 2000L multi or 810 500 deep probe and set my Pro 2 to 10 Hertz. If I was using the 810 2000L multi probe, I would treat one spot into each sacroiliac joint for 30 to 60 seconds, depending upon the size of the patient. If I was using the 810 500 deep probe, I would treat the line of the SI joint on each side, with each point receiving 30 to 50 seconds of treatment, depending upon the size of the dog. Remember, anytime there is dark skin and we're treating within the 800 nanometer wavelength range, it's always best to divide the total joules in half and cover the treatment area twice for maximum effect. All right. Thank you again to Companion Animal Lasers for sponsoring Optimum Pet Vitality and supplying a laser for us to show you how to treat the sacroiliac joint.
Once improvement is noted, start to decrease the dosage of pain meds and anti-inflammatories. Most patients can discontinue these meds or only use them on bad days or after strenuous episodes. We want to use laser, but also realize we need a multimodal approach and think about nutritional supplements, proper diet, weight loss, and other modalities for optimum results. The exercises I would recommend to start with rhythmic stabilization and Snoopies or diagonal leg lifts, if it's within their comfort zone. I hope you had fun. I hope you learned something. I'm Laurie McCauley at Optimum Pet Vitality. Thanks for joining me with Learn and Go with Laurie. Take care.